fact, it was exceptionally difficult and at times heartbreaking. After initial success with a son, my husband and I were pregnant 3 times before I gave birth to my beautiful daughter, all within the span of 2.5 years. My first experience with loss was an early miscarriage. My husband and I were devastated. After taking time to grieve, we tried again, and I became pregnant quickly. The beginning of this pregnancy was not as anticipated, as I suffered from terrible blood clotting and even thought I had miscarried again. After several weeks of physician monitoring and bed rest, I was reassured that my baby was fine. All of my first and second trimester screens came back negative. My baby looked healthy. I was thrilled beyond words and even started telling friends and family once the first trimester was passed. My due date was April of 2010. Following ACOG guidelines, we went for our 20-week ultrasound. We were looking forward to learning what the gender of our baby was. The tech was very talkative, but she didn't tell us about anything that she saw except that we were having a son. We were told to return to my doctor's office to go over the scan. We met with our OB, who subsequently told us that the ultrasound showed our child's brain ventricles were nearly twice the size they should be. We were heartbroken and we began to cry. After visits with several specialists to get second and third opinions, including a radiologist, a pediatric neurosurgeon, and a genetic counselor, all at Children's National Medical Center, each confirmed the horrible news. Our best case scenario, if our son even survived to term, was that he would have the developmental quality of life of a 2-month-old. We are given a diagnosis of ventricular megaly and hydrocephalus with the likelihood of anencephaly. We were told our 2 options. We could terminate the pregnancy, or we could carry the baby to term and see what happens. I even asked point blank about the chances of a miracle. The doctors at Children's tend to be hope givers, but for my question, they had no optimistic outcome to share with me. The visit confirmed the decision that my husband and I had made the previous weekend. We chose to end the pregnancy. I wanted to be around family, so we decided to deliver locally, as the surgical option would only be available in another state, despite this being a legal option in Maryland. There were no qualified physicians. The next day was Thanksgiving, and I somehow made it through the holiday completely in a fog, trying to ignore the kicks that were getting stronger. These kicks had no conscious thought behind them, nor would any of our son's actions. My husband and I went to the hospital and worked with the medical team to induce labor. My son died soon after delivery, and I was discharged the next day. I was 21 weeks gestation. Things felt so surreal. My body acted as though I had a baby, though my heart and mind knew better, and I cried thinking that the tears would never stop. We had genetic testing performed and also had the amnio tested for one of 3 viruses known to cause ventricular megaly. All these tests were negative. Our doctors were fairly confident that it was a fluke occurrence, a 1 in a million. 5 months later, I became pregnant again, and I was terrified. As a precaution, we were being monitored by ultrasound every 2 weeks to watch brain development. All of the regular prenatal tests came back negative for the usual suspects of chromosomal concerns. At 17 weeks, the brain ventricles were measuring at the threshold of 1 centimeter, the top end of normal. The following week, I was back at Children's, once again hoping for a miracle. In addition to ventricular megaly and hydrocephalus, we were told that the baby had a condition called partial agenesis of the corpus callosum. The corpus callosum is the band of neurons that connect both hemispheres of the brain. Outcomes for individuals with only a partial one are poor, especially when other brain anomalies are present. We were told that the first baby also shared this additional anomaly, but that the team didn't want to overwhelm us with information. My husband and I faced another agonizing decision. I would not wish this on anyone, once, let alone twice. On August 13th, 2010, we decided once again to terminate the pregnancy and say goodbye to our second child, this time a daughter. We were able to choose a surgical They knew what I was going through, and they could say from experience that it gets better. It's been over 5 years since my first termination. I'm back to being myself, optimistic, and eager to share our lives with another child. I was able to fulfill this dream in July of 2011 when I gave birth to my daughter, my second living child, who's wonderful in every way. In June of 2013, we completed our family when a second little boy joined us. The proposed laws in Maryland would have prohibited me from terminating my pregnancy, as I was 21 weeks gestation, and I was not in fear for my own health. This anomaly cannot be tested for, and only given the knowledge of the first pregnancy, we had earlier monitoring of options available to us. Decisions regarding pregnancy and reproduction should be made between a woman and her doctor. No one, especially the government, should interfere, as it truly is a family decision. These proposed laws are an affront to me and all the women like me who are faced with exceptionally challenging situations in highly abnormal circumstances. Maryland law should remain as it is, trusting women to do the right things for themselves and their families.